Hello, I'm Dr. GB Douglas. Today we'll see what your plan of action should be if you are diagnosed as COVID positive. You have been informed that you are COVID positive. You may be with symptoms or without symptoms. So you will be informing everyone whom you have met recently to get tested and also everyone who is staying along with you at home. Why is it important for you to inform your recent contact about your infection? If you see the World Health Organization website, you notice the cases are rising and transmission classification of India is mentioned as cluster of cases. And to contain the virus, we are identifying, testing and treating. That's why it's important for the sake of others and community for you to inform everyone. Our primary aim should be to recover from it. You will be contacting your family physician whom you trust and follow the doctor's instructions. Your doctor or your healthcare provider will assess your risk factors, symptoms, medical history, and also your family's ability to take care of you while maintaining proper infection prevention measures and advise accordingly whether to be hospitalized or to be isolated and treated at home. Majority of the cases are mild and can be managed at home. Today we'll go through the things to take care of and to follow if you are COVID positive and isolated at home. You can check in the description about the helpline numbers. Quarantine separates and restricts the movement of people who are exposed to a contagious disease to see if they become sick. Isolation separates sick people with the contagious disease from people who are not sick. Most of you would come forward to take care of your neighbor or your family member. Care should be taken to choose a member who is preferably in good health without any chronic conditions like diabetes, heart, kidney or any lung problems. Even though these are the stressful times, you have to be in a positive frame of mind to get enough sleep. Sleep is very important because it augments immunity. Place yourself in a well-ventilated room and if possible, open the windows. If you go to common areas of the house like kitchen, always wear a medical mask. Have your own set of clothes and utensils and don't share it with others. No visitor should be allowed until you recover completely. And always follow respiratory hygiene while coughing and sneezing, and remember to wash your hands with soap and water. Always maintain a distance of at least 1 meter from others while wearing a medical mask. Don't go out of your home to buy medicines or essentials. Ask someone or order online. Record your blood pressure, oxygen saturation and temperature thrice daily or as instructed by your healthcare provider. After you record it, note it in a book with the date and time. Stay hydrated, drink lots of fluid and eat nutritious food. Avoid oily and fried foodstuffs. You should have your own set of clothes and should be washed separately. After you wash your hands with soap and water, the handkerchief or the towel you use should also be washed. You should be isolated until you are no longer able to transmit the virus to others. Those with symptoms should stay isolated for a minimum of 10 days after the first day they developed symptoms, plus another 3 days after the end of symptoms. That is when they are without fever and without any respiratory symptoms. Ensure the patient rests well and is hydrated, and coordinate and keep the doctor informed about the patient's condition and always think positive. All the members of the household should wash their hands with soap and water regularly, should maintain respiratory hygiene while coughing or sneezing, avoid unnecessary exposure to the ill person, and monitor everyone's health for symptoms such as fever, cough, and breathing difficulty. So these are the warning signs and symptoms to look out for and inform your doctor immediately. Many people have recovered and are back to normal lives. Be positive and get well soon. Thank you for watching. See you in the next video.